some new faces.
Oh.
Let's give everyone a minute to join
Hello.
us. Hi, Gaetano.
Hi. How are you?
Very well. Thank you.
Thank you. Thank you.
Hi, everyone.
Hi, Maria. Nice to have you today with
Hello.
us.
Hear you.
Nice to see. Nice to join you. Thanks.
I'm gonna start sharing my screen, and also I will do some housekeeping here. I would like everyone to kindly mute your microphone, just in case. This session is recorded, and later on we will share everything online. All right. So I see more people are coming. Today, Claudia, a member of GoAQS, is going to help us with comments. So if you have any questions, please feel free to use the chat. We will try to answer your questions live, but in case we can't, we will come back to you with an email. All right, so I'm going to start because we have lots of people today that they help GoAQS and have decided to help in this session as well by sharing some key messages that we have also all to consider. Okay, so the key agenda for today is an overview, a general overview of GoAQS, a yearly review, what have we done so far, the white paper, of course, some next steps for GoAQS, and finally the key messages from our members. At the end, if we have time, we will go on a live Q&A, but I don't promise anything about that. So far, GoAQS has 170 people from 34 countries, 52 academics, and 118 experts. I think the number has changed since I created this slide, but more or less, this is the number that of experts that represent us, and they are from all over the world. This is the website readership, actually, how many people are visiting our website from various places, and for some reason, US is the first one, which is very important to consider, as this is a nation with quite many resources, and they should have had something in place about air quality, indoor air quality specifically, but they don't. And I think this is the reason that drives so much traffic to our website. Then is Spain, but forget Spain. Most of the traffic is coming from me. Of course, there are some other people from Spain that they are visiting the website, but let's say that I'm responsible for the hierarchy there. Then we have United Kingdom, Netherlands, and Germany. I would also like to say that there are some countries that they haven't visited GoAQS yet in 2025, and with your help, I would like to find ways to reach them as well. It's very important to reach many places in Africa, some places in Middle and South America, and as we can see also in Middle East, especially Kazakhstan and those countries, they have never had the chance to learn about the importance of indoor air quality. As I was browsing the readership, I also found that a small island country, which is called Trinidad and Tobago, has visited us multiple times, and it was very peculiar to me to find out that someone from there is visiting and wants to learn more about GoAQS. Also, something very peculiar about the visitors that they are coming to GoAQS, as they subscribe as well in order to receive information about what we are doing. We will see Department of Health from various countries, environmental agencies, independent consultants, even provincial councils like in Barcelona, and associations and research centers from all around the globe, which is very fantastic. As you know, we have a variety of working groups from particulates, carbon dioxide, ozone, formaldehyde, and so on. And we have also 2 new mold and bioaerosols. So if you would like to join those 2 working groups, please let me know and I will add you to that, as you will learn later on that we are starting some work around those pollutants as well. Those are the partners that they collaborate with GoAQS from the industry, but also some other non-profit organizations around the globe. And we are very thankful for all the effort and work that they have done together. Now, GoAQS in 2025 has been in many places. not only by myself, but because we have so many people supporting our initiative, like Professor Juliana Juladin from Malaysia, Professor Prasant Kumar, Professor Christos Argyropoulos, Francesca Brady, Tobos, Professor Bronwyn King from Australia, Georgia Lagudas from the Brown University, Alex Brock from the DDIACI project, the Ideal Cluster, and many other webinars. Magazines have covered GoAQS, and it is fantastic. We are so thankful for all of those efforts we have done together. Since November, we updated the white paper to a finalized version 1. You can freely download it on our website. Here is a QR code if you need it. And there you will learn about the most fundamental things about GoAQS, which is the 3 pillars. The air pollution limits, specifically for the indoor space. The indoor air quality score is an effort that we have done in order to unify the language around indoor air quality, and we will also like all manufacturers out there that they create solutions around air quality to use the same way to measure and communicate air quality with people all around the globe. And finally, indoor air quality policies are also essential, as not everyone knows what they have to do in order to fix indoor air quality. So we have specific areas, like, for example, what's happening in schools, what are the first steps we have to follow. And some of the most important things we have to do, like, for example, in schools, are, one, find someone that understands air quality or knows about air quality, then find some initial money in order to begin with a pilot program. And from there, you can expand. So far, this has been the way to make schools implement indoor air quality solutions, and we think also is a great approach for some other buildings as well. So you know, at GoAQS, we have 2 tiers for the limits. The starter, which is like the entry level. We would like to eliminate any barrier of entrance. We think it's very important to have all places, even those with very severe air pollution or with socioeconomic problems, access to this kind of information and start implementing with the starter tier air quality mitigation plans. And then we have the ultimate, where we base the limits on health outcomes. And you will find the most strict values as well. The index, as I talked earlier, is designed as a very user-friendly way to communicate what's happening with the indoor air quality. And I'm very happy to say that with the help of an engineer, Bogdan Kestea from Europe, we were able also to create a code example of how this index works. And we have created a repository where you can access and learn a little bit more. Bogdan has created a DIY air quality monitor and has implemented his solution there as well. Now, next steps. We will talk about the future of GoAQS, a paper we are preparing, the working groups we are starting next year, and the research proposals. So in order for GoAQS to succeed and continue growing, we need to establish it as a CAC, non-for-profit company in the UK. CAC means Community Interest Company. Then we will have a new expanding management team. So far, I have been doing all of the work, but now some help is coming. And this is fantastic news because I will have finally some time to breathe. And then we are also going to rename some of the existing groups that we have. A friendly pro bono agreement is going to be sent out to all members, as we would like to be transparent and also be a little bit more formal about the requirements of each different group. And finally, we are going to start with finding some fundings from national UK and EU grants. This will help us with the research project we have in mind, but also expanding our capabilities. So as I've mentioned earlier, a peer review is an ongoing process with the help of 17 academics and myself, so 18 people so far. We would like to go through this peer review process and solidify GoAQS findings with literature that supports our work. The working groups are coming in January, beginning with ultrafine and submicron particles. We would like to discuss the recent research findings and propose next steps for recommendations. Still, it's very early to have epidemiological data from those kind of particles, so we have to figure out there a way how we can recommend those two pollutants or particle sizes, if you like, for the indoor space. Then in February, we are going to move with the mold working group. Again, same procedure, sit down all together and discuss the latest findings, and also see what are the limits from around the globe, as some countries already have established some limits, and WHO also. And then on March 2026, we will also have discussions about bioresources. Now we are going to discuss a little bit about the research proposal. The first one is how can we use the indoor air quality monitors that we can find nowadays in many places as a tool to enrich epidemiological studies. Currently, we are using reference stations, which are mainly outdoors, in order to collect and measure different pollutants in various places around the cities. But that kind of pollution does not represent accurately, in my opinion, what's happening in the indoor space. So we would like to see if with the implementation of those low-cost sensors in the indoor environment, we can have a better understanding of the health outcomes. So now I have prepared a Slido, and I would like you to use your phone to scan the QR code and tell us if you are aware of a similar research project that wants to figure out if indoor low-cost monitors can provide air quality data that can support reference air quality data for epidemiological studies. Those are the results from the morning session. Most of the people, they didn't know, but we did have some yeses, and we request for those that they know about those kind of studies to communicate with us the papers in order for us to investigate a little bit better and see if it is exactly what we are planning, or maybe take the research that already has completed and implement it inside Go AQS. So I will give you like 20 seconds and I will move to the next slide, as we don't have time, but you have you can continue voting afterwards. All right. And the next proposal is how can we use the hypothesis is the following. If we filter the air inside buildings in such a way that we remove particles, specifically submicron particles and fine particles, but we are actually counting the particles, so we are very sure about the presence or not presence of those particles. If we are then able to recommend a higher CO2 level in order to optimize the energy usage. As you know, in Europe here, they really push for energy and decarbonization. And maybe this is a way to go. So again, if you would like to participate in this kind of research, feel free to scan the QR code or go to our website and communicate with us. And another Slido with the similar question. Are you aware of similar research project that wants to figure out if we can recommend less strict CO2 thresholds when active filtration particles is present indoors? Again, your input is very important to us. And again, if you know, please send us the paper or project or investigation that has been done in the area. Again, the majority of people, they haven't come across something, but there are still some people. So let's hope they can communicate with us this kind of information in order to understand better the work that has already been done. All right, so now we have the key messages from our members. And I'm honored to introduce a person whose tireless work has been dedicated to making vital information accessible to anyone around the globe. Her contribution to the field of air quality and climate is profoundly impactful. So without any further ado, I would like you to introduce you to Dr. Maria Neira. I think you all know her for her fantastic work, and she's going to talk about clean air for health. So Maria, the floor is yours.
Thank you. Thank you so much. And it's such a pleasure to be part of this fantastic and enthusiastic group and powerful network. Very quick and short messages. One, certainly air quality is the basic human right. We all need to fight for it. I mean, in the past, as the health community, we were fighting for having access to safe water and sanitation. I think we are exactly at the same level. We need to fight, which is quite strange because we shouldn't be fighting for the quality of the air we breathe, and we need so desperately. But clearly, no clean air, no public health protection. And several myths that we need to change. Air pollution, until a few years ago, has always been very much associated with respiratory diseases. I think today we have more than tons of evidence telling us that it goes through the bloodstream, and from there it can reach any organ in our body. So air pollution is bad for our health. All of our organs will be affected, and this will have very clear negative impacts on our protecting the health of our people. Second myth is the fact that maybe we are focusing too much on the outdoor air pollution, the ambient air pollution, and we need to focus as well on the quality of the air indoor, because we spend a lot of time inside. So accelerating the transition to clean sources of energy is a public health issue. So it's not just something that the governments of the energy ministers or the COPs negotiating on climate change needs to focus. Is our responsibility as well as members of the public health community. And we need to do our best to influence and to accelerate this transition to clean sources of energy, because our life will depend very much on that. And the last message I would like to share with you is that there are very good positive opportunities by addressing the issue of air quality, lack of air quality. We can obtain enormous health benefits, and therefore as well enormous economic benefits, sustainable benefits that we need to use to accelerate this transition and to make sure that we convince our politicians, our ministers of health, our ministers of energy, our ministers of environment, our mayors, and those in charge of these policies, that there is a lot to gain from a societal and economic point of view, and not only for public health. So very pleased to be with you, and I'm sure that we will be doing things which are very positive together. Thank you, and back to you, Sotiris. Thank you.
Thank you so much, Maria. And your sentence about air pollution affecting us, not only our lungs, but our brain and our heart, still resonates inside me since your first talk at TEDx. So thank you for repeating this fantastic sentence and truth, actually. So our next speaker is Professor Pavel Workoki from the Department of Environmental and Resource Engineering in Denmark. And Pavel was also in the morning session, but we will have the chance to hear him again. Pavel, the floor is yours.
Well, thank you very much. I'll make my message very quick. Can you hear me? Yes, I think. So, Maria, I completely agree with you. I think the point of the AQS as a fundamental human right has been expressed by WHO and has not been probably implemented, or we don't have a proper regulation to execute it. So I think this is one of the very important things, and it's obvious that we need to do it, but we need to have a certain tools or the way how to get there. I think a fundamental issue here is that we need an IQ metric. This is my first message, is even crude, but operational. We must benchmark buildings to decide what they suffer from. The challenge is to agree on a metric and deploy it widely. And this is what we have been fighting for many years, and we haven't been able to basically come to an agreement here. I think also we should go beyond the traditional measurements of exposure and also look at the measurements of the human physiological responses here to this respect. My second message is that we should break the bubbles. So we should avoid the bubble effect that is present because today the stakeholders involved in the buildings and indoor air quality, they speak to each other. And maybe not hearing the other stakeholders. Architects talk to architects, energy and decarbonization engineers to themselves, and medical sciences to themselves as well. So those boundaries have to be broken, and medical sciences are extremely important because my third message is that IQ should be considered a public health issue. Maybe IQ is not the main cause of all our health problems, but at least we should consider that this is a modifier of the health effects. So, that is a need to. This is why it is important to collaborate with the medical sciences from this respect. My fourth message would be, and even though we now have a lot of arguments, we still need more arguments to convince those that are not convinced that IQ is important. IQ is usually considered as very costly and also increasing carbon footprint. However, improving health of people by improving indoor air quality can actually reduce carbon footprint because that will reduce the carbon footprint from the health medical treatments and healthcare that is considered to be responsible for up to 5% of all the carbon emissions. So here is, I think, an important link to the decarbonization to show that IQ actually can bring the benefits, not only economic benefits, but also can reduce carbon footprint. The fifth message would be to change the narrative. I think IQ usually is presented in the negative, on the negative side, so that there is some problems with IQ, but maybe IQ can be presented also as bringing the benefits, improving our life quality. So this salutogenetic approach to the IQ, I think, could change the how people and general public actually accepts or look at the aspect of indoor air quality, and may make it, that people want to have it. My sixth message would be that the solutions that are for indoor air quality need to be affordable and for everyone. Meaning, today, the solutions are usually considered as to be expensive, so they need to be affordable for nearly everyone, and also be flexible enough that can actually be used by people depending on their preferences and needs. And finally, I think I want to say that we need to also focus on education. So, for example, we need to have an IQ education for all stakeholders. Today, IQ is probably somewhere, I don't know where, it's among some engineers, maybe a little bit about architects, maybe medical doctors. But I think it is important that all of those important stakeholders have a proper education about indoor air quality. So, for example, the medical doctors can learn about the benefits of indoor air quality, and then maybe one day when we go to our general practitioner, we will be asked about what is the condition at home, and not only what we eat and what we drink and whether we exercise. So I think to close my messages, I want to say that in Europe, the new Energy Performance of Buildings Directive creates an excellent vehicle for promoting indoor air quality, because this is the first document in which energy is put on a par with the indoor air quality. So that can be a method to further promote for indoor air quality in buildings. I stop here. Thank you very much for your attention, and thank you for the invitation.
Thank you, Pavel. Your message and the 9 great steps, I think, worth our consideration. So I would like to continue with Dr. Iyad Attar. He's an air quality and air filtration expert from Kuwait. And today he's going to speak about optimal air quality, leading the charge for sustainable change. Dr. Iyad, the floor is yours.
Thank you, Sartorius, and good afternoon and good evening. I actually have a plan of 4 pillars, and I have a couple of messages I want to highlight in the end. Let me just remind you that around 2014, 92% of us were exposed to poor air quality. We pledged to work hard and deal with the status quo. The result, 99% of us today is exposed to poor air quality. It doesn't take a lot of math to realize we're not on the right trajectory. So we need to go back and redo the math of what we're trying to do. What I'm proposing is 4 elements that if we can do it in a textbook manner, we'll be able to realign this air quality quest. So clearly we need to reconfigure it. First one is we need holistic monitoring. We focus on indoor air quality monitoring, but this is, I would say, part 3. Part 1 is outdoor air quality monitoring, knowing what we are up against, physical and chemical characterization of outdoor air pollutants. 2, indoor air quality monitoring. 3, personal air quality monitoring. And then the 4th one, which is usually neglected, is filter performance. We want to know what is the air quality coming out of that supply air diffuser. Once we know the monitoring data out of all of these 3 segments, we will have a lot of information to deal with. Having said that and done it, we go or move to stage 2, which is the dynamic system performance. How is our HVAC and filtration system? And note, I said filtration system, and I didn't say filters, because it's about time air filters have to be systems. They communicate their performance, they give data and receive data and act upon it. How fast HVAC and filtration system? 3 things will be of a paramount importance. 1, variation in indoor air quality. 2, fluctuation in human occupancy. 3, the specific activity aimed for this indoor space or building envelope. If it's a gymnasium, if it's school, the proximity between 2 individuals will certainly make a difference. Having established the first 2, we move to step 3, which is data-driven governance. We need to govern air quality, but we also need to fix the hardware first. We want to make sure that we've got step 1 and step 2 done appropriately. And having the granular data to be able to govern air quality, supply data and receive feedback, and how fast we respond to any variation in the 3 elements I mentioned is going to be of critical importance. The 4th and the final element, at least for today, is how can we correlate air quality and public health and well-being data together? How many lives have we actually impacted, saved, enhanced? How many people were getting sick prior to intervention? And then after we intervened, we've improved 6%, 60%, 90%. This has got to be clear so that we can assess what have we actually done after we intervened. Now, I got a couple of things that I want to maybe challenge myself and challenge the audience. One, we aim to go for energy efficiency all the time. We've been doing it and singing that song of energy efficiency for the past 50 years. I think it's maybe time now to allow public health and well-being to be on the driver's seat. Not neglecting energy efficiency, but if there's a case where I need to spend the energy to save lives, I would do so. And again, since the clean air is a universal promise. Let's agree on what clean air is. There are so many VOCs. Smoke has several pollutants, particulates. Let's define what we plan to deliver and promise. Tutorius, that's my message for the day. Back to you.
Fantastic, and thank you so much. We really need to give priority to air quality. This is the key message I'm taking from you today. Next, I would like to introduce you to Dr. Gaetano Settimo. He is a coordinator of National Indoor Air Quality Study Group and president of the Italian Indoor Air Quality Society, obviously in Italy. And he's going to talk today about the indoor air quality in Italy and the current situation and future actions. Dr. Gaetano, the floor is yours. We cannot hear you. Dr. Gaetano, are you there? Let me see. He was earlier, but maybe. No, he's not connected for some reason. Anyways, we will move with the next speaker, Professor Christos Argyropoulos. He's a chemical engineering in the King Fahd University, Saudi Arabia. And today he's going to talk a little bit about indoor air quality, models, and Go AQS. Professor Christos, the floor is yours. Christos, are you there?
Can you hear me now?
Yes.
Okay, nice. First of all, I would like to thank you for the invitation here and also for the to be part of this initiation and about the Go AQS. Most of you, if you know me, my background is more from the aspect of modeling, computational fluid dynamic modeling. So what I'm going to tell and try to suggest here is about how the models can help to make useful prediction for indoor air quality in buildings. Okay, and more specifically, my research has been focused more on building infiltration. And as you know, here in Saudi Arabia, we have got a lot of problems with particles matters, and all of these, they have got huge effects and health effects, more specifically with young children, with asthma, older people with COPD, and many, many other vulnerable population groups that we have here. So in my case, what I want to suggest and what I want to give us a message is that we have very useful models, especially in computational fluid dynamics and multi-zone models that can be used in order to provide us very useful predictions for different airflow patterns, temperature, for instance, how the concentration of the contaminants of the pollutants can be dispersed inside to buildings. And this is very useful for us in order to be able to develop the appropriate mitigation strategies and how can identify ways to reduce the pollution, the indoor pollution. Another thing that is very important is that, and also Go AQS can help us a lot, especially from the aspect of comparison, our numerical prediction, numerical results with standards and limits and thresholds in order to be able to see what's happening and how can be, in a way, evaluate that a strategy that we're suggesting can be useful and has got a real meaning. And don't forget also that the models can help us a lot to see and evaluate different ventilation strategies and also the HVAC systems and how all of this can be implemented in such a way in order to try to reduce the indoor air problem. Also, the models, most of the models have been created and, for instance, validated in areas that don't have, so heavy loads of PMs, like, for instance, here, we have got dust storms events, we have got many, many particle matters issues. So I believe, and this is very important, that we need also the scientific community and also to find funds to further improve our models. And also, in order to do that, we need to have validate models. And in order to do that, we need, for instance, to compare our numerical results with low-cost sensors, data. Also, if we could, it's possible to do some trace gas experiments in order to see how this can be help us in further improve them. And of course, don't forget that all of these models, they have got a balance between the computer sources that we need. So based on the complexity of the problem that we have and all of this, we need to further improve also the computational sources and the advances for fast simulations. On the other hand, so there is, about that, and we have discussed, we are in the age of collecting huge amount of data. We can collect a lot of data from different buildings, different regions in different seasons, and it's important how we can perform further data analysis. So we are in the age of AI. We have got machine learning algorithms and many computational tools that we have to try a way to use them efficiently in order to be able to use and take the advantage of AI in order to, which is the most important thing for us, to try and find solutions for the indoor air quality. That's from my side. I don't want to repeat things that the previous people here mentioned about that, but what I want to say is that it's very important the people to understand that their breathe in a way is not something that we're taking for granted. It's very important to understand that we need to have and to write for every human being in the planet of clean air. Okay, and that's also what I want to close my messages here. And also, as I mentioned, Sotiris, for me, it's very important to try to collaborate with many other people from different regions on this planet and try to see what is the best, also to improve further the AQS, and also to try to find and identify many and useful ways of collaboration. Even this has to do with modeling part, or even though with low-cost sensors, or even though with collection of data in databases that can be useful for many people that work in indoor air quality. That's from my side. Thank you very much.
Thank you, Christos. Benchmarking is very important indeed when we all follow the same standards, and this is what we're trying to do. Next, we have Jose Fermoso Dominguez. He's a research engineer from Cardiff, a research center here in Spain. And today he's going to share with us something that I learned a couple of weeks ago, how they have already implemented GoAQS methodology in a research project. Jose, the floor is yours.
Thank you, Sotirios. Hello, everyone, and thank you, Sotirios, for the invitation to share our experience or the practice that we are doing. I'm coordinating the European project K-Health in Air, and one of the actions that we are doing is we are applying one of the methodologies that we adopted for data analysis is the GoAQS methodology, and because it gives us a unified framework in some way to assess the indoor air quality in very different environments, like we are already monitoring with our project, like homes, hospitals, or the schools, and also to in some way value what could be the conditions as in good, moderate, or unhealthy, as it's used in GoAQS, in a way that it could be both rigorous and also intuitive for non-expert. That is something that we think is very important. However, it is important to note that these categories are applied only for the parameters, or we are using this for only the parameters that we are continuously monitoring, because in some way we are also sampling other pollutants such as, for example, PAHs and or certain semi-volatile compounds that they require specialized equipment or target sampling in specific spaces. So one example, we can find that even when the PM levels that we are finding are really low, below the recommendations in GoAQS, we can still find theoretically is still possible, and even we find in some practice some examples that we have that the particle matter also contains some pHs about the recommended levels, and so even when we could say that is safe or good for some parameters, maybe we can, in this sense, we can say that GoAQS provides a robust but necessarily partial view of the indoor air quality. Within the K-Health Theater project, we pair this framework with monitoring sensor, and also we use target sampling of PM, pHs, VOCs, aldehydes, radon, and microbiome. And we use all these, we combine, or this combination of parameters or sampling and continuous monitoring help us to understand in real drivers of poor indoor air quality and develop practical recommendation for households, for example, and public buildings. Just to let you know, we are already monitoring more than 300 households in 3 different countries within our project. We also work with to create like a user-friendly indoor air quality monitoring tools, and in this framework, we also want to use this indoor GoAQS methodology, because data only creates impact when people can interpret it and act on it, and so we try to also couple these GoAQS standards and recommendations with some actionable actions in the monitoring tools, like using traffic, like a traffic light indicator or something like this. And our role is support healthy behaviors, identify avoidable pollution sources through data analysis, and guide intervention that truly improve indoor environments. Finally, please let me tell you that also I would like to say that K-Health Center is part of the IDEAL cluster. This is a group of, you're already aware of it, but this is a group of European projects working together to advance indoor air quality science and to promote evidence-based policy recommendations. And through the cluster, we collaborate on harmonized methodologies. One could be DSL, or is being promoted, is GoAQS, also for data interpretation strategies and communication tools for end users. Just to sum up, we think that applying GoAQS within K-Health Center has helped us to turn indoor air quality data into something meaningful, comparable, actionable, and useful for improving people's daily life. So that's all what I wanted to share with you.
Thank you, Jose. You see, in Europe, unfortunately, we are very fragmented when it comes to indoor air quality. Every country has different metrics, different limits for different pollutants, and how researchers can collaborate if they don't have a common tool, right? So I'm very happy GoAQS fulfill this need from your side. So thank you for being here with us today and sharing your story. Next, we have Lula Timmerman. She's the lead technical expert in indoor air quality, federal public service health in Belgium. And today she's going to speak about why indoor quality is a public health priority. Lula, the floor is yours.
Thank you. Good afternoon, everybody, and thank you to Sotirios and GoAQS for inviting me to share a few reflections from the perspective of the Belgian Federal Public Service of Health. Indoor air quality is not only a technical or an engineering topic, it is at its core a public health issue. The air we breathe indoors, at work, in schools, in shops, in sport facilities has a direct influence on our health, our cognitive performance, and our long-term well-being, as we all know. And because we spend more than 85% of our time indoors and often don't have agency of our own air, the quality of this air has consequences at a population level. That is precisely why Belgium chose to integrate indoor air quality into a formal public health framework. Our 2022 indoor air quality law defines clear public health objectives and introduces a phased approach for all publicly accessible indoor spaces. It's grounded in science, proportionality, and actionability. And also the law introduces reference values that act as public health norms. So norms that are concrete, measurable benchmarks of what is healthy indoor air. But we have seen that that's only possible for a few of the many possible pollutants. We need more, we need bigger, we need more comprehensive view of what we can see as a public health norm, what we can see as what is indoor health. Because these norms matter, because they translate public health goals into actionable requirements. They bridge the gap between scientific evidence, sector practicality, and real-world implementation. So that's already a great step that Go AQS puts in the right direction, in our view. Another important element which Go AQS also incorporates was collaboration. Belgium created a national platform for indoor air quality, bringing authorities, researchers, ventilation and filtration experts, different sectors, and the general public together to create a multidisciplinary approach to ensure that norms are not just written, but they are also evolving with new science and are feasible for the operators. But this is not enough. Air does not stop at the border. If we want a real impact, we must widen our scope to a European or a global approach. Like the initiatives at Go AQS that include worldwide stakeholders is a great example of that. Creating a global consensus that produces clear guidelines, which pushes everybody in the same direction, where indoor air and outdoor air is a global responsibility. As we look in the future, indoor air quality will only grow in importance due to climate change. Ensuring that good indoor air quality structurally is essential for public health, with benefits far beyond the health sector alone. In Belgium, we are working on transparent monitoring when CO2 meters, ventilation data, or purification certificates are visible and understood. They build trust and empower citizens to make their own informed choices. And we also try to invest in capacity building for actionable interventions. Smaller operations, schools, cultural venues, and local communities need practical, accessible tools and a guidance to meet public health norms in practice. We don't want to wait for the homes and the buildings of tomorrow. We want to help the people now. So we think that getting a general view of existing buildings is something we can't ignore. In the end, the future of indoor air quality will be shaped not only by regulations, but by a shared commitment to prevention, health literacy, and collective responsibility. So I think we can all work together, and thank you for the opportunity to be part of this conversation.
No, thank you, Lula, for sharing the example that Belgium is following, and also for telling us that the future of indoor air quality is today, not tomorrow. And next I would like to present Andrew Guido. He's a building biologist from Canada. And today he's going to share a little bit the reality when it comes to implementing the ASHRAE 241 in housing. Andrew, the floor is yours.
Thank you, Sotirios, and hello, friends and colleagues. I'm really excited to be part of this group, and I'm hoping to take advantage of our findings as we build future residential homes. So for those of you who don't know me, I founded a company called, it's a startup, Earth 360, whose focus is on whole home systems to improve the indoor environment. It's something a little bit like what Dr. Wargocki from Denmark talked about. I'm working on the positive. How do we improve the environment for those people that occupy it and avoid people getting ill? I position it as more good days than more bad days to try and get the public to understand. I was acquired by a large private builder. Just to give some context, in North America, we built thousands of homes. We're in the US and in Canada. And I also, for them, head up sustainability and innovation. So I'm one of the insiders, almost like a Trojan horse, trying to change things from the inside. In this last year, I want to share some of the research that I've been doing myself and on testing the ASHRAE standard 241 that was created and published in 2023. As a matter of context, I went and retrofitted and tested 3 existing model homes that were not occupied, and then 1 model home that I designed and built from scratch from the beginning, which I'm proud to share that we won Global Innovation Home of the Year from the National Association of Home Builders this year. So it was a nice acknowledgement that we might be on the right path. The 3 homes that we tested were never occupied. We went in, we recommissioned them because they're a little bit older than 5 years. And we tested the ERV to make sure that it was performing as graded. And of course, they never do. And we identified one of them that was like 70% of what it was rated for and decided not to remove it. Thought it would be a really good part of the test. All 3 homes that were ordered for 5 years failed the ASHRAE 241 equivalent clean airflow requirement for infectious aerosol test. And that was expected, as they were never designed, and they were, even though we build above code, we never build too far above code. The home that was designed from scratch overperformed, and it delivered and it passed the ASHRAE 241 test, which was interesting. It also tells me that maybe we over-engineered it. Maybe we went too far because all these things add money, and it creates more pressure for someone, and particularly in North America, we're having a huge affordability issue, and we're trying to figure out how do we build better homes that are more beneficial for occupants and not tip the scale on affordability side. We then went and retrofitted the 3 homes that failed, putting in larger ERVs, changing in 2 of the homes, the 1-inch filter that comes standard with every home. It was a MERV 11. We upgraded it to a MERV 13, and we added a 3-stage bypass HEPA filter with a MERV 11 pre-filter, an active carbon filter, and then a HEPA filter that was there. We did not use any disinfection equipment, which is also part of the options of ASHRAE 241, and we decided to do this from that basis. What was interesting was that all 3 homes passed once we made that change, except for the one where we tested the ERV that was operating at roughly 70% of what's supposed to have been 125 CFM unit. Could not make it, couldn't get there, which was also very, very interesting in terms of the findings. And so some 3 takeaways that I want to share with you is: 1, code compliant does not mean 241 compliant. And the failure on the 1 home sends a message that you need, if you're not going into disinfection, which we're not comfortable at this particular stage with the technology that's there, you're not going to get there. You need ventilation and filtration in order to be able to get to meet the standard. There are various options and various ways of being able to do this, and we're still very curious about how we might configure and what we might do. And then the other part, as we discovered, is validation and commissioning are not negotiable. You have to test. You have to determine if you're getting what the manufacturer said on the label that's there. And this is why we believe at this particular stage that field testing is very important versus us going out into the marketplace and saying that we did this based on design tests and modeling. We want to be really comfortable that we're not misleading anybody and that we're creating these environments. So thank you again for Sotirios for inviting me to share those results.
Thank you, Andrew. And this morning we had Professor Panaras, who's a mechanical engineer, and he said something similar, that there is always a challenge of compromising something when it comes to a building. And in most cases, air quality is the first to be compromised. Next, we have Dr. Pedro Branco from Faculty of Engineering, University of Porto in Portugal. And he's going to talk a little bit about the elephant in the room and bridging the gap between science, policy, and practice in indoor air quality. Pedro, the floor is yours.
Hi, hello everyone. Hello, Sotirius. Thanks for the kind invitation, and thank you especially to you, but also to all the colleagues involved in Go AQS. This is really an amazing organization and group of committed people. I would like to just to give a very brief insight, because the session is already long. About something that I believe it's a real challenge, and it's not something not technical, which in my opinion is the gap between science, policy, and practice. So basically, we have our universities and research centers, and I come from one, producing very good, excellent even research with advanced modeling, sensor networks, health impact studies, air cleaning technologies, and so on. But most of this knowledge sometimes stays in journals and conferences, and so gets a little bit lost in that world. On the other hand, we also have some let's say some gaps between policy and practice. We have that, okay, policy has to influence practice with the enforcement and regulation and standards, but then sometimes there is no feedback from practice, and sometimes these regulations cannot be put in practice so easily, or there are a lot of limitations and struggles between policy and practice. And on the other hand, we also have this link between science and practice, which science should benefit from practitioners to get the chance to get real world data. But on the other hand, it's important that they do also have the chance to do applied research and technology transfer to the practitioners. So that's why I wanted to bring here this gap. If you imagine like a triangle with science, policy, and practice, I would say, and the message that I would like to give you is that I would say that the success lives in the interfaces between these three worlds. So these gaps exist. This gap exists. It's mostly due to fragmented communication between these three worlds, the lack of incentives and collaboration, policy lag, which is very important because the timing in policy is not the same as the timing in academia or in science or in practice, weak enforcement, limited awareness. So a couple of reasons could exist. So in this case, it's something that I would like to bring to the table, that IAQ failure is not only because of technical or technological constraints, it's also because of these broken connections between these three worlds. So yeah, this is the main message that I would like to bring to the table. Yeah, I would say that we need stronger channels and knowledge transfer, clear guidelines, training programs, collaborative projects like this Go AQS. We are really putting people from science, policy, and practice all together. And all these initiatives are really important because we need effective and practical tools that work for everyone, science-based, based on evidence, and with real impact. So thank you again for the opportunity, and I would like to I look forward for continuous collaboration with all of you. Thank you.
Thank you, Pedro. I think you described very well what GoAQS is trying to do. It's going to elevate the communication around all of those work that you and your colleagues, scientists, are doing around the world in order to educate the political system and policymakers. Finally, I would like to introduce you to Heike Granger, if I pronounce her name well. She is the founder of another nonprofit, which is called Nano Control from Germany. And specifically, they pay attention to ultrafines and how important is for everyone to start looking into those specific nanoparticles that they linger inside the indoor space. So Henke, the floor is yours.
Thank you for your opportunity to deliver our message. I feel very honored. I'm the chairwoman of the NGO Nanocontrol Foundation since 2017, and I have a dream. I have a dream that one day the air we breathe indoors will be safe and clean. For more than 20 years, the team of the Voluntary Nanocontrol Foundation has worked toward this goal. Our mission is simple but vital: clean indoor air, air we can rely on. This vision was born not from theory, but from experience. Many of our members have lived through the consequences of long-term exposure to ultrafine particles from toner-based laser printers and copiers, printer-emitted particles, or PETs. Some became seriously ill, yet they continued helping others, sharing knowledge and standing up for a safer world. More than 4,000 reports from affected individuals, the canaries of the coal mine among us, show that ultrafine and nanoplastic particles can cross biological barriers, reaching every cell, even the brain. And the facts are clear. 2,000 anonymized cases analyzed by Professor Dimitar Bello and his team at the University of Massachusetts Lowell, published in the Journal of Occupational and Environmental Medicine, revealed respiratory problems in 90%, allergies in 70%, technicians with higher risk for cancer, and with visible toner exposure, chronic fatigue, asthma or COPD, and cardiovascular diseases. Our call is clear. It's time for prevention, for rules, limit, and transparency on invisible indoor air pollutants. As Professor Dean Schraufnagel said, air pollution is a silent epidemic, and PM01 is perhaps the quietest of all pollutants. Printing just one page can release billions of ultrafine particles into the air. They don't disappear, they accumulate over the day, measured 33,000 particles per cubic centimeter. Together with the Go AQS initiative, we are developing transparent, science-based international standards for indoor air quality. Thank you very much. We are waiting for 25 years for this.
Thank you. Thank you so much. And in addition,
one moment.
Yes.
Our call is clear. Limit ultrafine particles below 1,000 particles per cubic centimeter, following the WHO best practices to protect people's health indoors, where we spend 90% of our lives. So yes, I have a dream that one day everyone can breathe safely indoors, without invisible threats and with confidence in the air around them. That dream begins here with all of us. Thank you.
Thank you once more. And unfortunately, Gaetano couldn't make it today for some reason. So we don't have any more speakers. So the time has passed. I will ask if someone wants to ask a question, one or two questions. I think we can take them, and then we can close this session. If you have a question, please raise your hand and I will redirect to you. No questions. So Claudia has done a magnificent work answering all the questions in the chat. So thank you once. I see one hand from Luis. Luis, please.
Excuse me, I made a mistake.
Oh, okay, no worries. So once more, I would like to thank everyone for joining this session of Go AQS. We would like to appreciate from our hearts, from me and from my team for being here today, presenting and also supporting Go AQS in your capacity. Again, Feel free to reach out for the research proposals we have and also the working groups. And we are always open for collaborations. Thank you so much. Have a great afternoon from Europe.
Thank you,
Thank you.
Sotiris. Bye, everyone. Nice to meet you, all of you.
Thank you.
Thank
Thank
you.
you, everyone.
Have a nice Christmas, everyone. Thank you.
Nice Christmas. Yes,
Thank
nice
you.
holidays.
Yeah.
Thanks. Bye.
Straight up.